Hi, everyone. I'm NewBeauty's Director of Aesthetic Content, and today I'm here with facial plastic surgeon, Dr. Dilip Madnani, and we're talking about a topic that is super relevant right now, which is facelifts, but more importantly, facelift longevity. How long should your facelift results last? Welcome, Dr. Madnani. Thank you for coming to NewBeauty and speaking with us about this today.
Thank you for having me.
Thank you so much. And now we know from public discourse that facelift results and how long they last are trending right now. What should everybody know about facelift longevity?
First of all, it's great. I've been in the facelift business for almost over 15 years now, and it's always been busy, and now there's such a great buzz about it. So I'm glad we're having this conversation. I think it'll give some good insight and good clarification on what's out there. The bottom line is whenever you've had a facelift, you'll always look younger and fresher than if you never had one. So My answer always is it lasts as long as you do. So we don't stop the aging process. Now, the other question is, so what's the aging process? And I think that's a more nuanced question and nuanced subject that people don't really encroach.
And it's so interesting right now because facelifts have become such a hot topic, primarily because we can't really tell anymore if someone's had a facelift. People appear to be aging backwards, and I don't know what they're doing, but I want to do it too. But how has facelift surgery evolved in the last decade? Obviously we're seeing the evolution right in front of our eyes, but what's happening behind the scenes that people might not know about?
There's a couple of things happening behind the scenes, and being around the last decade, I have seen it. I've seen it, what it was 15 years ago when I first started. I'm seeing what it is, what I'm doing now. Me and my friends, we joke that facelift surgery has become so complicated. It's no longer just tightening the neck or no longer just tightening like a jowl, like a mini lift. And when I started off, I was doing mini lifts, right? And now we're doing these, I don't even call them facelifts anymore. We call them full face rejuvenations. So what exactly has happened? One thing is, I guess in this country, in North America, we were so focused on the jowl and the neck. In other parts of the world, they're focused on the upper face. And I think, and other parts of the world are focused on volume and bone shaping. Like it's really been a confluence now of all these different topics. And it's easier to learn and share information right now too. So I think what we've done now is incorporated the full face into what's called facelift surgery.
It's one term instead of these, combination of procedures that you're actually doing when you're in the operating.
Correct. I never really just do a facelift. We're doing blepharoplasties with facelifts. We're doing brow lifts. We're doing volume enhancement with fat transfers. We're doing skincare. And I joke with my team all the time. If I could do every day, all day, book me two surgeries, I'll be the happiest person in the world.
Yeah.
Just do a face and neck lift, brow lift, fat transfer, and laser.
Is that confusing when people come in and they say, I want a facelift, and then you have to sit down with them and say, okay, I'm going to be performing a neck lift, a lower facelift, a brow lift, sometimes a blepharoplasty. Does that create some confusion when you're having a consultation?
Yes and no. If you're putting it as a cold patient coming in, asking for that, sure, then it's a long, detailed consult. Right. The nice thing about what we can do nowadays is put a lot of content and information out there. So my patients are coming in already knowing, they'll say all the buzzwords that I'll say, they'll ask me about the brows. So they're coming in educated. So by the time a patient gets to speak to me, you've spoken to at least 5 people in my practice, and you've seen all my videos online. So they're not coming in cold.
And then on average, facelift results, I don't think we talk about this enough. We talk about how breast implants, their longevity, the devices are supposed to last like 10 years, but we don't really speak on how long you can expect your facelift results to last. I know that you said once you have it, then you're aging in a younger way, in a younger trajectory from then on. But if you were to give it like a timeline, is there a specific length of time that facelift results
I say 10 to 15 years.
10 to 15
is what
years.
I say, that for those who want to look perfect. So I've been doing this long enough where I'm doing third facelifts on some patients, or patients who've had facelifts earlier on in their lives are coming in. I'll have 80-year-olds come in for their third facelifts, or 70-year-olds come in for second.
But they started younger?
Exactly.
Okay.
Yeah, they started younger.
That's good to know.
And there are some that's on a schedule. Every 10 years, I'm going to get my face done. Are we doing exact same surgery? No. When I go in for the second or third time, there's much less skin to be removed. It's mostly deep tissue tightening. And then you're doing other enhancements, whether it's skincare, volume, those kind of things.
And is there something that as a patient we can do to ensure that we're closer to the 15-year range than the 10-year range?
Yes. So this is a conversation that we have with all of our patients is basically 5 things that you have to worry about. Number one, first is skincare, right? You want to be on top of your skincare, and that starts early on, and then you maintain it afterwards, because those are things that will just protect your collagen, protect your skin overall. Number two, I suggest my patients to do something for skin tightening at least once a year.
Okay.
So I'm a fan of these energy-based devices. I know they go kind of back and forth.
What do you prefer? What do you use at your practice?
In my practice, we have 2. We have microneedling with radio frequency, and we have ultrasound energy-based device. So I've had them for years. I've used them on myself, my family, and we use them on patients who are not quite ready for facelifts, younger patients, and we use them on post-facelift patients. I tell my patients to do it once a year.
So if you are not ready yet, but you still want to get that lifted or tight, a little tightened look, or just a little bit of improvement, that's what you recommend, not surgically.
Exactly. That's something that to do. The other thing I'm suggesting after the energy-based device is something resurfacing for your skin at least once a year.
Right. Because the tightening is different than the resurfacing, right?
Correct.
So if I go and say, hey, I want this non-surgical, Ultherapy Prime or something like that, or an ultrasound treatment like a soft wave, that doesn't take care of the outside, the radiance.
Which is why Korea is so famous, because they stack treatments. Which is why we also suggest, in my practice, we are educating patients. We're stacking treatments at different layers, right? Skincare, resurfacing, skin tightening, volume. Those are all things that patients need to be doing. Other things to do is keep your weight where it's at, right? Large fluctuations in weight will age you. And then being healthy overall, exercising, staying out of the sun. Exercising, not getting sunburns. I don't like to say stay out of the sun.
Right.
But I like to say don't get sunburned.
It's not realistic to say stay out of the sun.
But don't get sunburned. You can go early morning or late in the afternoon. Smoking and then keeping your weight where it's at. Those are all things that are great to maintain. And then genetics also plays a part.
What skincare? You mentioned skincare, and just out of curiosity, because I like to know what people recommend, but what do you recommend? What do you sell at your practice?
Okay. There's basically 4 products that I have all patients use. At nighttime, I like some kind of retinoid type treatment. Everyone should be on that. Everyone should be on a daytime vitamin C type product.
Okay.
Everyone should be on a sunscreen, and everyone should be on some kind of moisturizer.
So you want cellular turnover at night. You want us to take care of our pigment and, brightening and radiance in the morning.
Correct.
Sunscreen to protect. And then what was the fourth one?
Moisturizer.
Okay. Is there a brand that you like in particular?
We use Skin Better in our practice.
Skin Better's
we also
amazing.
sell some elastin.
Love elastin.
And we're starting with a little bit of plated.
Yes. Exosomes. And what about GLP-1 patients? Because we're seeing a lot of the effects of weight loss. A lot of people are on a GLP-1. I'm sure you've seen it at your own practice. What do you recommend for patients who are seeing this accelerated sagging, skin laxity, and they weren't expecting it, and they might be trying to fix it with different other modalities? What is your best advice, and what should they be looking at?
So I think you said 2 keywords. Number 1 is accelerated. And number 1, didn't expect it. So I think early on they didn't expect it. Now they're expecting it. Because we're getting patients coming in for pre-consults.
Before they even start losing weight? Yes.
They're like, I just wanted to get in. I wanted to get on your schedule, or at least get in, be a patient so that when I need it, you're not going to make me wait. And then number 2, the accelerated weight loss.
Yes.
That's the key, right? That's what causes that looseness, the sagginess, the volume loss, and the aged appearance on your face.
Well, I was going to ask you are in the different planes of the face. Are you seeing a difference in the tissue than what you saw maybe 5-10 years ago?
Well, we don't typically see that amount of weight loss or that amount of laxity. I mean, today the patient, she's 2 weeks post-op.
Okay.
She's super happy. But a conversation I had with her, and she's like in her late 60s, early 70s.
Right.
But a conversation I had with her is, hey, you may need a tweak or touch up in a year. Not because I didn't pull as tight. And you'll see her 2 weeks later, she's pulled as tight as possible.
Right.
She looks phenomenal. But because of that rapid weight loss, that elasticity, collagen in your skin is not going to rebound as quickly.
It's so interesting. So if our skin is like a rubber band and I've been on a GLP-1, then I may be less
elastic,
less bouncy, less elastic.
Correct.
And so the results won't be as taught.
A year from surgery.
Correct.
Right. May not be. So I'll say my patients like 20-30%. Let's have this conversation.
Yeah.
But I also had the same conversation with my patients who've had a lot of sun damage. That your collagen isn't as tight as a younger person or a person who's protected their skin. Like someone with my complexion our complexion.
Right.
Right? Where
Yeah.
ours is more forgiving rather than someone with a Fitzpatrick 1 or 2 who's spent a lot of time in the sun.
And then what is your advice on when to have a facelift if you are undergoing these changes and you have, let's say, 60 pounds to lose? Do you wait until you've completed your weight loss journey and then undergo the procedure? Or is this something you should do when you start noticing like extensive changes?
That's a great question. I have a cutoff number. If patients are like, I'm going to lose more than 15 pounds.
Oh, wow.
Then I'm like, okay, then wait.
Are people upset? or are they
Not upset. I think they're motivated.
Yes.
Yeah, they're motivated. They got realistic. I mean, I would hate to do that. You lose 15 pounds, and then I'm like, and they're like, like I look great, but I wish it was a little tight. I'm like, well, let's optimize everything. I mean, it's a contract between the patient and myself.
Right.
Even when it comes to aftercare, even when it comes to like maintaining afterwards. The surgery sounds simple. Everything really sounds simple, but the prep and the work that goes into prepping the patient on my team side and the patient's commitment to taking care of themselves afterwards, right? I'll have patients that, I don't really have someone help me afterwards, or I'm just going to go back to work after a week, or I'm just going to no, you should, no, let's do this. We're going to work on your face. You can't hide it under a t-shirt.
It's not a laser.
Exactly.
Yeah.
Make it look easy, but I think even my team sometimes, like we make it look so easy, but the point of making it look easy is to minimize any potential complications or unhappy results, right? So that's where all that hard work comes in into making it look seamless.
What is the biggest mistake patients make after surgery to compromise their results? Outside of what you just said, is there something that they're doing that you find people do often?
I mean, in terms of expectations, there are certain misunderstandings, but in terms of what they can do, I mean, initial post-op, we just want you to follow our instructions to the T.
Yeah.
And then after that, it's really up to the patient how much maintenance they want to do. Most of it has to do with scar care, but their patients are very motivated to take care of their incisions afterwards.
Are you into any of these other treatments afterwards, like hyperbaric oxygen? Yes. I noticed that's become a really popular tool for recovery. Can you explain a little bit about that and how it helps?
So hyperbaric oxygen exposes your body on a cellular level to high concentrations of oxygen. It energizes the mitochondria, which are the energy cells of the cells, and that gives you more power to heal. That's the thinking behind it. I suggest my patients to do 24 to 48 hours before the surgery, 1 or 2 sessions, and then 4 sessions afterwards. That's basically, you can do that daily after surgery.
Yeah. And it helps with everything, right?
Healing, yeah.
When someone is on a GLP-1, the messaging you get about Ozempic face is to go and treat it, right away. So if they're going to get non-surgical treatments, does having biostimulators injected affect a facelift in the future if you're using that type of filler?
Yes. So these are all things I would like to know ahead of time.
Right.
But it doesn't preempt you from having surgery.
So we're talking about Sculptra and Radiesse, right?
Right. Those are the
And the big discourse online with a lot of facial plastic surgeons is don't do it if you're planning a facelift surgery.
Correct.
Right.
Because it just makes the tissue planes more sticky.
Yeah.
Right? Doesn't mean we can't do the surgery.
It's just more difficult.
Correct.
Right.
And I think we'll get cleaner tissue planes. But even doing energy-based devices, I'll have patients come in, or even my team will have pre-consults with patients. Say, I'm interested in doing surgery in like a year from now.
Yeah.
And then they'll call and ask, hey, can we do some Sculptra? Can we do some Radiesse? Can we do some energy-based treatments? And my answer to them will be like, no, I would rather you not. There's no need to, because then when we go in there, it'll be cleaner tissue planes. If you're like, I'm never going to do surgery, we'll do something to make yourself feel and look better. Injectable fillers are fine. Skin surface treatments are fine. But if you're going to go anything deeper with energy or, as you said, with collagen stimulating, then we want to be more careful.
If you did have recent collagen stimulating injections or use a filler like that, should you wait a certain amount of time before undergoing your procedure?
I don't think you should really have to wait, but I think every surgeon will have their own preference.
Got it.
For me, I don't think it's really affected my outcomes, and you're very comfortable with the anatomy. It does make it more difficult, but I don't think you really have to wait any certain period of time.
Got it. And what about facelifts trending younger now? We're seeing a lot of patients who are under 40 or right at early 40s undergoing a facelift. What are your thoughts on that? And will this mean automatically that you need to get a revision 10, 15 years down the line?
Okay. So we don't treat a patient based on their age. We treat them based on their skin laxity. Some patients, unfortunately, just have early onset skin laxity and they're motivated to get something done. Facelift techniques are so good now that we can,
they're undetectable.
Undetectable.
Yes.
I just did a 35-year-old.
Yes.
She's 4 weeks now. She couldn't be happier.
This is the conversation that my friends and I are having. I'm 48 years old, and I never thought I'd be in my 40s and we'd all be talking about facelifts. But that's
this
happening.
Patient was 35. She had a GLP-1, had some other procedure done that felt really aged her, and the facelift, boom, she's back to where she was. She goes, it's exactly what I wanted.
Yes.
I don't want anything else. I did a CO2 laser on her because she had some dyschromias on her skin, and she's 3-4 weeks out now. She couldn't be happier, right?
So it's really patient dependent.
And it's not something I'm pushing. It's not something that I'm advocating for. Performed so many early 40s facelifts, and then we're doing brows and others, and they're just coming back, and they're just looking like phenomenal because everyone's working out, everyone's taking care of themselves, and they're just like, I just feel like the best version of myself. No one knows they've had facial rejuvenation procedure, but everyone's telling them how great they look.
Yeah. I think that's just so interesting about this generation, Gen X and elder millennials, is we are more accepting of surgery. There's not as much of a stigma. And I think the generations behind us are even more so accepting of using cosmetic treatments or procedures to enhance or make you feel better or fix something that's bothering you. But I think it just speaks so much to where we are right now that people feel so empowered at a younger age to just, whether it's called a facelift or not, to address something that's bothering them.
And I think it's cultural, right? Because different countries, depending where you're from, it's normal. And for other countries, it's not. So I think this country is definitely come of age. You know, Eastern Europe, or South America, Latin America, those places, it's been more, it's been more norm. But I think our techniques here are just, I'm amazed at what we can do. And I'm just amazed at how much better and better it gets, and how much luckier our patients are now, just because of our understanding overall as a surgeon of the anatomy, what's possible, the techniques out there. And I mean, every year I'm also learning newer things that I'm bringing back into my practice. And even my team are like, we do Monte Carlos. We're like, wow, the results are just getting better and better.
Yeah. It's amazing.
Which is nice.
And I just thought of this, like the facial plastic surgeon probably doesn't get as many accolades from their patients online because not everybody wants to share that they've had a facelift surgery.
That's also changing. But yes, we've had, I'd say about half our patients, or 30% of our patients, allow us to share their journeys. But even then, it's a small amount, but it's enough that even like yesterday's surgery was like, yes, you can film because I wouldn't have found you if someone else had shared their journey online.
Yeah.
So I was like, thank you.
Yeah, it's a sharing, educational. Wonderful. And if for people who are having non-surgical treatments to address their signs of aging and they're not sure if they're ready for a facelift, what's the tipping point? How do you know, okay, I've done everything and maybe it's time?
We get this conversation. I have this conversation a lot with my patients. And I'll tell them that my job is to tell you whether you're a candidate. Your job is to decide when you want to do the surgery.
Right.
And when they're coming in, last week I turned almost 2 or 3 people away, which is rare, because they were just not surgical candidates. Even one lady was in her 60s. I was like, your skin is so taut that there's not much that I can do for you.
Yeah.
And then I had a younger patient come in, and she was so on the fence, and she was like, my schedule, my this, my kids. I was like, well, here's what I can do for you. I said she was a candidate for, brow lift and a blepharoplasty and a facelift and a neck lift and a fat transfer and a laser. And then so I'm like, so you have to decide when it fits your schedule, when it fits your life, because I need you to commit 2 weeks.
Right. My last question is, if you are looking for a facial plastic surgeon, what advice do you have for patients? How do we find the right doctor that's going to do our surgery? Great.
So I think patients have a lot of information in their fingertips, right? Mm-hmm. It's not always the most marketed, but I think, which is technically, I wouldn't correlate the most marketed surgeon as the best surgeon.
Right.
But patients can meet their surgeons. They can have conversations. They can speak to past patients. They can review before and afters. I would still check credentials online.
Yeah.
There's still crazy things happening out there. You can look up medical boards, information about surgeons as well.
You want to make sure your facial plastic surgeon is board certified by which boards?
So I'm board certified by ENT or otolaryngology, head and neck surgery, and facial plastic surgery. And then there's a facial plastic surgery boards.
Yes.
So I'm a subspecialty of otolaryngology, head and neck.
And those are all under ABMS.
Exactly.
So American Board
of Medical Specialties.
Medical Specialties.
Yes. But right now, I mean, I've seen many different specialties trying or opting to do facelifts.
Yes.
Which is fine, but it's the onus is on the patient to make sure that the surgeon has a lot of before and afters. Those before and afters are not being photoshopped. I'm still seeing Photoshop images online. They're getting harder and harder to tell.
Are some of them AI? I think I've been seeing some maybe AI, or I'm not sure what I'm seeing online. But
my staff, Ariana, she showed me there was from Brazil or somewhere, they taken one of my before and afters, they AI'd the before and the after, and then they put their branding on it.
And it's your patient.
It was my patient.
Work.
Yeah, it was so easy to tell. Even that, I was like, wow, even the before and after was AI'd.
Wow.
It was crazy.
It's insane. So you really have to check and make sure, not just credentials, but make sure that what you're seeing online
look at incisions.
Is real.
we show all of our incisions even in the videos. Videos I think are harder to fake. But you look at your surgeons before and afters, because you will see my before and afters have a certain look. You will see others before and afters have a different look. Meet your surgeon. Ask about their team. I think that's super important, right? The team is very important because they're going to take care of you before and after and in surgery. So you want to make sure that you're in a certified facility where you're having the surgery. The nursing care and the anesthesia care are all top notch. So you should ask all those questions.
Those are great questions to ask. Before we wrap up, I just wanted to ask you, is there any other kernel of advice that you have for someone who's considering a facelift or a revision even right now on how to get the most natural and undetectable results?
I think have the conversation about, or being open-minded when you go into the consult in terms of, just like we said, you mentioned in the beginning, educating the patients about, hey, this may not just be your face. You may also need your brow, or you may need a little upper left, or some skincare, or a little bit of volume here and there. These are all conversations that your surgeon will have. We're not trying to upsell or do more surgery. We're just trying to explain the entire aging process.
You can fix something and then it'll draw attention to something else, right? If you're not looking at the face as a whole.
Correct. And there's so much information out there. There's so many new techniques. There's netting sutures, there's brow lifts, there's deep neck lifts, there's all this really fun stuff.
Let's talk about that really quickly while I have you, because that is another big, it's the mesh, right?
No, so these are done just with regular proline or nylon sutures, monofilament sutures.
And what is the purpose of that?
The purpose of it is just to minimize swelling and bruising and bleeding in the immediate after surgery period. Yeah. They're removed within 3 to 4 days after surgery, so they're not permanent. Some surgeons we will see online, they will net the entire face and use it as part of their surgery. I use it more.
Is this the netting here?
Yeah, you'll see it there.
I know exactly what you're talking about. Yeah.
And some people will net the forehead and the eyes.
And it almost looks like a spider web of threading throughout.
Correct. So I'll net behind the ear here where I tend to get some bleeding sometimes, and under the chin. I found that it decreases the swelling, decreases the pain, and decreases the bruising. So it's so much more comfortable for my patients.
So it's not cute to look at first, and you do it back here. Yeah. And in 3 or 4 days, it's gone.
Correct.
Yes. But I've seen a lot of pictures online where people are
really
like, what is
crazy,
this?
But there's some crazy ones. Some surgeons are going with their full face, which is fine. That's just their techniques.
Well, we're in a really interesting time now, and I want to thank you so much for coming and speaking with NewBeauty and for all of your insights. And I'm sure we'll be talking to you more, because facelifts are just the gift that keeps on giving.
It is right now. It's a great field to be in. Thank you as always for having me.
Thank you so much, Dr. Madnani, and thank you, everyone.